measured 7 feet in between each chair. Like, that's excessive.
Yeah.
It works, but
That's all you see is they talk about, 3 to 6 feet between people, and then you see the, presidential press conferences. Or any press conference, really, even the governor wants like shoulder to shoulder, and everybody behind them, you're like, well.
They all want to get on TV.
Or it's like the lady who goes, yeah, she gives the speech about how you're supposed to, stay healthy, don't touch things, don't touch your face, and then she licks her hand and turns the page.
Rex husband? She's not married, is she?
She must be.
Klobuchar's husband?
Yeah,
Yeah.
yeah. He's
She's what?
Amy Klobuchar's husband.
Has the COVID-19.
Has
What
COVID.
shocks me is that Harvey Weinstein
Her
got,
husband.
isn't he like in
Oh, I was thinking-
isolation?
oh, yeah,
and
I was
for
thinking somebody
23
else.
hours a day?
prisons
Yeah.
are the worst right now.
You're right.
He's
I was
he's
thinking
only
somebody
been
else.
here
One
for,
of the vice president?
he's only been here
That's why they want to let them all out. How smart is that?
He's only been out for a couple of weeks though, in lockdown. Yeah, we're starting to change some of our stuff, where they're supposed to be, asking people to come in, like,
Oh, yeah.
And apparently at like the prisons, they're actually taking temperature of the officers when they show up. And they
So I wonder,
actually had
I
one
wonder if
person
when they're out
already
on the
test
campaign
positive.
trail and stuff.
I think it was saying
She's still out
cloud.
on the, she's not.
That'd be terrible, the couple hundred inmates that
Since
are
I
there and all
dropped out,
the
I was
guards all of a
saying
sudden get it at the
campaign.
same time.
It's like it's basically like a cruise
I
ship.
know her.
Some legislative stuff that they're trying to
From the
wrap
beginning,
up.
so she's got to take her temperature before she leaves for work.
Yep.
And then when they get to work right away before she enters the building, they'll take another temperature. And then they got to take a temperature of all of the employees.
Where's this at, what?
At the New Beginnings over at Waverly,
Oh, who do you know that works over there?
my daughter, Shelley.
Oh, does she? With Don?
Huh?
Does she work with Don Layla?
I
Where does she
don't
work?
know. That familiar, so she works at the men's one,
Oh,
by Humphrey's place. You're probably talking about, it's a little ways south where the women are.
I'm not sure which one is which. Have you seen that?
I was watching a thing the other day that they were talking about the lowest possible percentage of people get infected and the highest possible outcomes of positive things that happen, and there still wouldn't be enough ventilators or anything by, hundreds of thousands, just insane. So at Knowles right now, we could have like 120,000 people, and there'd be
General Motors is going to make them.
yeah,
Ford is starting to.
Ford is starting. Yeah, they approved all that.
Which is surprising because usually the FDA would
Well,
be all over that. saying,
Oh, you can't do that.
You guys ready?
Yeah, but you go by the car lots, you see all the pickups and all the cars in there.
All right, we're gonna go ahead and call this special city council meeting in order at 4 o'clock on Monday, March 23rd. Roll call.
Marty Manson,
Tom Marslick?
Cole Andrew,
Kirby Moynihan.
Wayne McCormick?
Kevin Triplett.
Dwight Johnson.
Michelle Otto. We're gonna start with Kevin.
So first item that I have on the agenda is some maintenance care and cleaning of the fire station. As most of you may know or may not know, that building and this building was constructed in 1995. We've moved into 1996. Since then, we've spent next to nothing on building care and maintenance, so it's served us very well as far as its integrity and just its upkeep. A lot of that goes to the thanks of the guys and the thanks of the city staff and everything with keeping things the way that they were designed to be kept. However, with it being 25 years old now, there are some maintenance issues that we would like to start addressing and get taken care of. So we've identified 4 priority projects that we'd like to get on the list to try and get taken care of within the next year. I've been getting quotes on those projects. Those projects include replacement of our service man doors, so frames and doors for both the exteriors, and then just doors for all the interior doors, so that's a total of 5 doors. Interior cleaning, so that's having the cleaning company come clean the the underside of the roof, all the lights, basically wiping everything down, vacuuming it up, cleaning very well. And then interior painting and exterior painting is what's all included in there. So I've been working on getting some quotes for all those things. The doors are gonna cost about $14,000 for all those. That's new hardware, new everything, so basically, we're gonna have some nice new doors essentially. Interior painting was right around $5,000. Exterior painting is right around $7,500. And then the cleaning project is about $8,500. So things aren't cheap, but again, we have 25 years of diesel exhaust, dust, soot, everything in there that the fire service is really trying to pound down on cancer prevention, cancer mitigation, and things like that. And this is something that we can do to do our part in this. And with it being 25 years old, I thought that the price tag was actually going to be a lot higher than that. The other project that's coming on the horizon would be roof repairs. We're going to wait until the company comes out that we're now working with to take a look at it and give us some recommendations and stuff. I don't know what that cost is going to be yet. So I guess it's up to you guys if you guys want me to read off the two estimates or the one estimate that I got for one of the projects and go from there, or just authorize to get these things taken care of with a not to exceed amount of, I don't know.
What's your totals that you have there?
So
And
Russell's
all out total?
all out total.
Yeah, did you have that or?
I can have it in 5 seconds.
35,000.
So not
Wow.
to exceed like,
Good job.
not to exceed like 50.
That's kind of what I would like. And if it does get more than that, if all of a sudden the roof guy comes out and says, yeah, it's gonna cost you 15, 20 grand, I'm gonna bring that back to you guys before we, do something with it, obviously. But all of these projects, I've been writing things down, what we thought that they were. I have a lot of resources on the fire department and stuff. And, I'm well under half of what we kind of had estimated. I figured that the doors were gonna cost us right around 20 to 30. I figured that the painting project was gonna be around 20. I figured the cleaning part was gonna be around 10. So I mean, we're under what like an engineer estimate would be, I guess. So
On your bids you got, how wide apart were they? Were they pretty close or?
So with the doors, we just got one from Russell's Lock and Key. They do all of the city's locks and doors. If I have another company come and do the door frame and stuff, I still have to have Russell's come out and do the locks and stuff. So I just did the one with them, and that was cheaper than what I thought with knowing what Wendy spent on these two doors. That number I was pretty happy with. The paint was way off compared to the two that I had come out. One was at 21,000, the other one was at 13,000. And the one that was at 21,000 has never done a fire station before. The one that's at 13,000 has done several fire stations before. Okay, I think I know what I'm going to do on that one.
Yeah.
Cleaning came in pretty consistent. One was at 8,500. I think the other one was at 9,500.
And that's like ceilings and walls. and
Not the
that's-
walls, because the painters are gonna come in and pressure wash. They're gonna clean the walls before they paint them.
It's just ceiling lights.
So ceiling lights, basically anything that's hanging from the ceiling essentially, and the inside of garage doors, things like that. So, everything was pretty good except for that painting pole, which was, way off in my opinion, but I couldn't figure out where the differences were either. They both had the same style of paint and everything, and don't know where it came from.
So total you said was right around 35,000?
Without the roof. Yeah.
Yeah, about the road.
Nice.
And I would imagine you don't have that funded.
For the station stuff? Oh, easily.
Oh, yeah, yeah.
So, back before I was chief, they always put, and correct me if I'm wrong here, Wendy, like 20 or 30,000 into building care maintenance into our capital improvement. Some fairly decent number. And like I said, we spent very, very little other than some minor repairs and fixes and stuff. So the money's definitely there, without question or problem. I'm not concerned about that at all. Our bank accounts look very, very healthy on the fire department side right now, so.
I think since I started here in '97, we were putting $76,000 away every year, and that was for trucks and building, and it's gone up now to over $100,000 a year for both, so there's plenty there.
Well, we need a motion, right?
Yep.
I'll make a motion to have the fire department move forward on the priority projects for cleaning, care, and maintenance of the fire station.
I'll
not to exceed $50,000.
No.
Yeah.
I'll second.
Tom,
Aye.
Nikki,
Aye.
Kirby,
Yes.
Lloyd,
Aye.
and I'll vote aye, motion passes 5-0.
Thank you very much. So I'm not gonna do any of that until this whole COVID stuff probably calms down, because I'm gonna clean all that crap off too, so. But hopefully here as things progress, we'll get that all taken care of.
How often are they, you guys are just wiping down all the stuff daily or every couple of days then?
Right now, guys aren't up here at all, unless there's a call. And then I'm trying to kick them out
As soon as possible?
quick as possible, essentially. So we're trying to do our part in limiting things. Once this all gets taken care of and stuff, we'll probably do a deep clean of all of our equipment and disinfection of the trucks. And we're cleaning stuff as we use it, a lot more details with that. But as far as just our general cleaning of the station and stuff, it's kind of been, I don't want to say we've let it go, but it's not really a priority right now.
A little more lax.
A little more lax, so.
All right. You want to do the emergency management?
Sure. Open up the emergency management side of things. Not a whole lot has changed. A lot has changed with COVID-19 over the course of the last week or so since we met last. However, as far as emergency management and our role as a local city government goes, our stuff has not changed dramatically, which is good, I guess. It sounds like everything's going well staff-wise for what we've implemented and stuff, which is a good thing. We've taken some, I don't want to say we took some drastic proactive steps at the beginning of this, but we did take some steps to try and work with the cards that we were dealt, which I think was the correct thing to do. And I think we were showing that we're being, looking out into the future and being semi-proactive with things, which is what a lot of this is. A lot of what is going to happen in the future here is going to be very reactive. There's nothing for us really to do proactive-wise anymore. We're going to basically be taking our marching orders from the Department of Health, Homeland Security, Emergency Management, the county, the state, all these other organizations. We don't want to reinvent the wheel here. There are some other cities, not in Wright County, but more metro-based, that are trying to reinvent the wheel, and it's they're seeing a lot of pushback and issues as it relates to trying to create more strict or less strict orders and stuff like that. So they're running into a lot of problems. We don't have the staff or the equipment or the means to be proactive in this. So our priorities right now need to be the protection of our critical infrastructure and critical staff. And we've already put some things into place to help with that, which again is a great thing. And your guys' support at the last meeting with that stuff is huge. We have spoken with a lot of community events and organizations. Feed was, so I talked with Feed, a couple of people involved with Feed last week after our meeting. I didn't tell them they had to cancel. I tried to make them make that decision rather than me tell them, hey, you have to cancel. In the end, they did do that without me having to tell them that they had to, even though I was well prepared to say, hey, you can't. I did lay down that, hey, you can't use the fire station. I can't have people sitting in there. You can't, do X, Y, and Z. They were all very receptive to the points that I brought up, a lot of their volunteers being at the high-risk category and things like that. So they did ultimately decide to postpone or cancel this month's feed anyways. And I told them, hey, moving forward, if you guys want to plan to do some kind of curbside thing, I think you have enough time to work on that. But to try and do it within a week's time, it would have been next to impossible to do, I think. Talking with Jess after that was pumped out over social media that it had been canceled, she received a lot of feedback, I'll call it, that canceling the feed program when citizens need it most and blah, 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 which, yes, that's a concern and stuff. However, I want to caution the city, staff, council, and everybody, our priority through this is not the individual citizen. We still have to keep them on our minds, but our priority really, really needs to be our infrastructure, our emergency response, and planning for future issues as it comes up. There are resources available to people. Food shelves are still open. Health and Human Services, we have emergency food boxes that we can get to people if they're in dire emergency need and stuff. So those things are in place. So stopping the feed program, that was a very big preventive measure. Would it have gone on without a hitch? I think so. We probably wouldn't have seen any issues with it. However, if one issue happens, now it spreads like wildfire in our community, which we don't want to do.
I think they'd have had a tough time getting people to even come and work at it because 95% of their workers are retired and in the stage of over 70 or 80 where they're.
Hybrid, so overall, I've gotten a lot of thanks and appreciation for what we're doing on my end of things. Also, there's been some people who have been wanting constant updates and what the city's doing about X, Y, and Z, and I just refer them to either the county or the state a lot of the times. If we pump a whole bunch of information on our Facebook page or on our website, I feel that it's either just repeating what everybody already has access to otherwise and kind of creating havoc because, yep, now we're buying into this line of thinking when the state's on this line of thinking. We need to try and keep a very concise and straightforward message to where the right information is being given to everybody. And that's one thing that we can be semi-proactive about still is that with, lack of better terms, kind of biting our tongues sometimes almost. And it's very hard to do in cases like this. We've pumped out a couple of important messages, just sent out the one about the toilet paper and the sewer and stuff like that, which is important because that's our critical infrastructure that we have to be worried about. I'm going to try and pump one out this week about fire response and police presence within the city and stuff, and let everybody know that we have plans in place and we're monitoring the situation, and as we'll continue to do so as this develops or subsides, one of the two. I still think that we're just at the tip of the iceberg as everybody reads in these news releases and stuff. This is going to continue to expand to a point. We're not on the downslide yet. I think we're still upticking. However, with the strong emergency management we have with the county and at the state level, there's not a whole lot for us to do in a pandemic type situation like this. We don't have our own health department. We don't have our own police department. We don't have a full-time fire department that can sit and just write things down and have all these glorious plans for a pandemic exercise at the whim. So luckily the state and the county do have guidelines and some guidance and stuff as far as things like that go. That's why it's important to remember that this is a health emergency. This is not a flood or a tornado or earthquake or huge catastrophic fire that happens across a whole block. So it's a lot different than some of the emergency management stuff that we prepare for and think about. However, a lot of the same stuff works between those and this health emergency. Public information is a big one, like I've already kind of discussed. We have to do our part in limiting assumptions and conjecture and things like that, which we've been doing a very good job about. If we want to talk amongst a group and, think X, Y, or Z might be happening, what is our response to X, Y, and Z? That's a good thing. That's us as a group talking about what are our plans. However, if that starts getting leaked into the social media and things along those lines, that's where things blow up. A lot of, when the governor made a statement on Friday, there were a lot of people, and this didn't come from the city, it came from everywhere, that thought, oh, he's going to lock us all in our houses and blah, blah, blah. And that created, I know, a lot of phone calls for Wendy because we were talking about it. That created a lot of emails getting sent to the fire department. What are you guys going to do? Are you going to restaff your station? The county got overrun with calls and comments and suggestions. Again, we're not going to be able to control that. We can't lock down the city. The county can't even lock down the county. The governor can essentially lock down the state within reason. If you see some of these other states that have put in lockdown orders, a lot of what are in those orders are what Governor Walz has already established within Minnesota a week ago, shutting down businesses and bars and restaurants and things like that. There are some other businesses that he could essentially shut down without any issues to match what like California, New York, and Washington have been doing. However, their grocery stores are still open, people are still free to move about. They're told not to. And it kind of goes with, you know, everybody gets all concerned about these numbers that the state has pushed out, you know. No gatherings more than 10 people, no gatherings more than this, don't do that, don't do that. The key is, remember, those are guidelines. There's no state statute or, there's an executive order attached to it, but it's not like, okay, we're gonna have a meeting of 13 people, 3 of you are going to jail.
SWAT's coming. right?
Yeah, here we come, look out. Couldn't get to that point, I don't know how it would. Things like that haven't happened since the times of the Civil War. So it potentially could. I don't know what it's going to look like, and it's going to be tough. And then at that point, we're going to have to reevaluate too and determine, okay, what truly is essential for us as a community, and what do we need to keep on hand to continue to protect and make sure our infrastructure is servicing. So some things are going to be essential, some things may not. Building permits, those would probably be non-essential. Wayne and his guys, at least the wastewater plant, that's going to be essential. So we'll have those discussions as they come, but to sit here and try and figure that out right now when we don't even know if it's going to go that way, who knows? If you watch the news and the media and stuff, there's talk now that President Trump may start actually ratcheting down on some of these restrictions. Then there's some that say that the governors and stuff are going to start ratcheting up. So we don't know which way this is going to go. It could go either way, realistically. We have to be prepared for both, and I'm sure that everybody here has the little hamster on the wheel running right now, thinking about, okay, what if it does go that way? What if it does go that way? What happens when we have our first confirmed case here, which we won't even know about? So just have those hamsters still running. I have it running in 21 guys at the fire station as well. As far as fire service goes, so we don't have meetings until April 7th. We've done some changes to protect ourselves and protect our guys. The Minnesota Fire Chiefs Association has essentially told us not to have any non-essential trainings, meetings, events until this subsides. So more than likely we're going to be canceling our April meeting and truck maintenance, and maybe further depending on how long this gets drug out. But all of our guys are still trained at the ready, equipped, supplied to handle whatever we have to handle. So it's a hard thing having a young department like we do, but it's also a blessing that we have the young guys and a mix of some of the older guys too, because we don't have to worry totally about training, but it still has to be on our forefront. So Sheriff's Office is still in town. They are still responsive to calls. We're actually in a very unique situation in Montrose. We actually get a lot of undocumented coverage. Over the next few months, you will realize that parking lots are going to be one of the safest places in Wright County. We are not doing a whole lot of proactive law enforcement at this time because we're trying to take our part in the Sheriff's Office to prevent the spread within our ranks and keep people safe that we're interacting with as well. So numbers may dwindle as far as like traffic stops, warrant arrests, things like that. But we are still here. We're taking calls. Guys are responding to calls. They're patrolling the streets and stuff. However, you will probably see squad cars parked a little bit more frequently just because of what's going on. So, but with where we're located between two different areas within the Sheriff's Office, there's a lot of guys who frequent Montrose and stuff. I sit in Montrose last night for about 3 hours. I didn't have anywhere else to visit. I'd driven the whole rest of the county and just parked in Montrose for a while. So it's a good thing. It's also a bad thing, but we'll get back where we need to be once this subsides, I think. So.
Well, as I was sitting here, I was watching the kids out on the playground. the county keeps putting out information about, not playing on the play equipment, stuff like that. So I posted on Nextdoor. I'm not a Facebook guy, I don't have Facebook. But I try to get the information that they put out there so people can read it. And, it's like the old saying about you can lead a horse to water, but you can't make it drink, So as long as people have access to the information, I don't know what else to do.
So, County Parks has essentially closed all of their playground equipment, but I don't know if they're taking it off or what they're doing. They weren't really clear on that. And again, it's to contain the spread of this because one kid, and kids are great carriers to this without being known of it, slides down it, and then I go to the park with my kid to slide down the slide, and now I get it because the kid went down it prior. It's the whole epidemiology thing of it. I don't know if we want to try to tape them off, but again, taking them off, it's just a waste of the tape, in my opinion, almost, because there's nothing to enforce with it.
They'll be there one day.
I think it's a good idea to maybe I'll send this to Doug to, limit time on playgrounds, try not to use basically tape right counties, or we can pump that out onto our Facebook
Make
website.
sure when you take your kids to the playground, you have your bottle of hand sanitizer and, what else to do.
Can you get some? Boy, I was trying to buy some.
Gotta make it.
The store was closed.
Jameson's works great. You just hold it in your hands and-
Maybe you can send it to Doug or to Jessica.
I hate to waste my
Yeah, I think
time.
that's probably.
Well, fortunately, we bought those big bottles quite a while ago, and we have one of those, so we keep filling up the little ones. But I know it's tough to come by, just like toilet paper.
There are a lot of distilleries in Minnesota, and a lot of them are changing over from creating alcohol to creating hand sanitizer. There's a really cool one in the St. Louis Park that Long Lake Fire Department reached out to, and I shared on my Facebook page and stuff, and they reached out to me and said, if you guys need something, let us know, we'll get your whole crap load for free. So hopefully once they get things switched over, I'll be able to have a little bit more around here.
Yeah, that'd be good.
We're pretty good. A lot of my guys, they have a problem with the way that I order things sometimes, I'll put it that way. When I order things through a medical supplier, you don't buy one mask and one bottle of hand sanitizer. You buy a case of it. Well, we're never going to use those. Finally, I could finally say to them, no, we're not going to use them, but I got them here right now and you can't get them anywhere else.
Right.
Having 50 bottles of hand sanitizer upstairs, granted the small ones, guys are like, we're never going to use that. Why do you should have just gotten 2 small ones and stuff like that. I'm like, look at me now, though.
Right.
So, it's not that we're hoarding things or, doomsday prepping or anything, but it's just being smart with our money and our logistics and stuff like that, which fire departments and cities have to be. And I think coming out of all of this, I think a lot of cities, a lot of healthcare agencies, a lot of sheriff's offices, fire departments are learning that hoarding within reason is the correct thing to do. As long as, we're not filling our entire station up with surgical masks and gowns, but as long as we have some on standby for if something like this happens. And historically, every year, every other year, depending on how you look at it, some kind of outbreak happens, whether it's the flu one year or SARS one year or the swine flu one year, whatever it is, there's always some kind of an outbreak. This one here just has a infection rate that is through the roof. That's why this one is so intense and so.
And its mutation capability, it's already mutated a couple times.
Yeah, I think we're at the 5th mutation of this right now, if I've been following things correctly. So there's a lot of mutation with this, and it's learning and changing every day, which is a scary thing for a lot of these epidemiologists and stuff as well. So again, I think we're doing everything on the city side that we need to be doing at this point. A lot of it is just continuing to follow updates, and if something major happens, and I was very happy last Monday when we had our meeting. Was it Monday or was it Tuesday? It was Monday. That we were able to put an emergency meeting together pretty quickly and stuff, and that showed me that, hey, this can work. So if something major does happen, even if we don't get the entire council or something, just so that we have some direction and stuff like that. That's a very good fact for me to have in the back of my mind when I was trying get that first one set up with Wendy and Deb and stuff. They were already thinking about it too, which is great. I was concerned, crap, we're gonna have to wait for 3 days because it's gotta be posted and do this, that, and the other thing, but to see it actually come together and, nope, 4 o'clock this day. Cool, I'll be there. That's a great thing because this is a very fluid situation and things are changing on a daily basis. But without any big monumental changes, we're just gonna continue doing what we have planned right now, I think, and move forward. I think we need to, we'll talk about some meeting options and stuff in case things blow up here and we all start getting quarantined or something like that. What is the plan or thoughts of April council meeting?
I think it should be canceled.
Well, could I
Yeah.
interject here along those lines? I said in a webinar this morning from League of Minnesota Cities about open meeting law and technology. And, naturally, a lot of cities have the wherewithal and the money to do simulcasts with TVs and all that stuff. We don't. And they said that if you have a smaller city, that you can have teleconferences instead of a physical meeting, as long as the public has access to that, to hear it, okay? So there are a couple of companies like Free Conference Call and freeconference.com. They have a very sundry of features and functionality where all of us would call in on a phone number. You could do it on your cell phone or on your computer at home, and you have an access code. The public can call into the same number, and they have a different access code, and what their access code does is mutes them during the meeting, so they can't speak during the meeting, but they have access to, everything that we're saying, just like they're on the phone with us, right? I think and the costs of the thing are one was give what you can. The average donation was $6 a month for this service. Their market rate is like $15, and a lot of them have limitations on money, on minutes, so you have to kind of, figure out which thing fits the best. It records the calls, so you can do your minutes off the recording. People can call in and hear the recording, just like if they were at the meeting. You have call control. This one here, you could have 1,000 people on the phone, which we would never have. They give you a detailed report, send it to your email. It's a mobile app, integrates with Dropbox, so if we have some kind of document that we need to trade, I don't know, I don't know if you know about Dropbox and all that, Lloyd, but, us old guys got to protect ourselves from this thing. And I'm thinking, this may be a way to go here. And there's various upgrades, and, we got to find out what the minutes are per month and stuff like that, but I really think we need to put somebody on this to investigate and see what kind of package we get for the city, and until further notice, do all of our meetings. You could have your fire department meeting using the same email. Parks and Rec could meet, Planning and Zoning could meet, EDA could meet, the same, on the phone, without having to worry about physical contact. So I would suggest that we look into this, maybe give Wendy a project or something, not Wendy, but Heidi a project, So,
I think it's a good emergency management tool to have. Even if we're not in a state of emergency like we are, it might be something good to just kind of
Just have on hand.
have on hand, whether we continue a subscription all the time and have it there, or just know that this is the company that we're going to have the go-to company for. I would like to still caution and just bring to light that if we have to have an emergency management meeting, me personally, I'd still like to have people in the room, because those meetings are going to be a lot of discussion, and with my experiences with teleconferencing and video conferencing, when you try to start having conversation and brainstorming and stuff, people talk on top of one another.
Yeah, you have to have somebody who has control of the meeting that can,
So if we have to have some kind of a major meeting, whether it's a council meeting, an emergency council meeting or emergency management meeting or something like that, we're not going to solely rely on that, still be open to the fact that we may have to have a meeting, we might just have to sit in different corners of this.
I think the key word there is emergency.
Emergency is the big thing.
Our standard council meetings, unless we have something emergent, we can do on a teleconference.
And you could limit, your council meetings with everything shut down, it wouldn't be a really long council meeting anyway. It would be basically approving accounts payable, and that kind of stuff that has to be approved each month so we can pay our bills. Anything that would arise that needs to be done, but a lot of the companies are shutting down anyway, you know. Nobody's contacted us for anything, so.
So I mean, you know, looking at the cost of this, I mean, it's like, I think we'd be kind of dumb not to look at it. You know?
Yeah, I think with Heidi, we could give that to her, something for that.
We'll just give her a list of criteria, say, you know, we can't have, I mean, we can kind of add up, our council meetings usually take an hour, Parks and Rec is, I don't know how long, planning and zoning, I don't know how long, so we'd say, okay, this is what we need bare minimum minutes per month. So they probably have programs that say, you know, up to 100 minutes, and the next program's up to 500 minutes. Or whatever. So
I wouldn't need any minutes for the fire department because I have email and active 911 that I can reach out to all my guys pretty easily with. And,
oh, so you wouldn't use
and
that?
our meetings are not open meetings, they're staff meetings. So, and also I get everybody's input the best that I can, but ultimately decisions are on me as the fire chief who you guys appoint. So if I need to put X, Y, or Z into place, I tell them, hey, X, Y, and Z is happening. We can discuss it later if we need to, but X, Y, and Z is now in place, essentially. So much kind of like public works and stuff. You know, they're not going to need it to have a meeting with their guys unless he wants to call and just get updates and stuff like that. But
I mean, I don't know if there's any contract, you know, annual contract or something you got to go with. All these, what are the two I looked at are monthly billing. So, I mean, we could do that once we get through this situation with COVID, we could reevaluate and say, do we need this anymore?
One along the lines of that, we should look at what meetings are absolutely necessary. Does planning and zoning need to necessarily have meetings in the next couple of months? You know, does Park and Rec, other than they have the Easter egg hunt, but it looks like that's not probably going to happen.
Or on the agenda is to cancel the Park and Rec and planning and zoning.
For April.
Even with EDA, you know, it'd be nice to keep the EDA going at this point, but, you know, a couple of months of just kind of suspending it. I don't necessarily.
The next thing was having Shannon come in, so I don't know if,
Yeah.
you know, we want to have Shannon come in and all sit in that kind of room there.
I think the biggest thing, not saying that all these other commissions and meetings aren't important, but again, I'm just reiterating the fact that safety, security, infrastructure, that's where we need to be at right now. Not expanding our borders or getting businesses into town, because with the way the economy is right now, you're not gonna happen. So you can meet all you want, planning and zoning, you can meet all you want, EDA and stuff, you can meet all you want, parks and recs, but nobody's gonna go out and park and rec events, nobody's gonna come into the stuff, and remembering that is the big thing. So I think right now, the biggest thing is probably one council meeting a month, essentially.
Unless there's an emergency thing that comes up.
Right.
You know, and you know, we have a little bit of availability here that we can spread out. I think that it probably would be better as well, that if we can get here just for 20 minutes to go over the accounts payable and stuff like that, it might be better to do it in person like that, just to show, you know, kind of a united front. We could spread out, we can have one person here, there, and people aren't gonna show up with all this COVID stuff going on. That's just what I think, that if we can come in, get it done in 20 minutes and be out.
I don't think it's a bad thing though to look into it. I think we could look into the teleconferencing, just, I mean, if this goes on and it gets worse and we shouldn't be meeting and it goes on and we need to meet, you know, April might not be as bad, and if we have to meet for a few minutes in April, we meet, but by May, it might be something different, and we're still gonna have to conduct business, so I think it'd be a wise thing to at least look into it, see what we need to do to get it going, and
Oh yeah,
how much it
especially if
costs.
somebody
Yeah.
here were to get sick, you
Yep.
know, that they can still call in and be a part of all that discussion. That
So I
we can-
Well, look at what's going on in the U.S. Senate right now. There's several senators that are testing positive, and they have no means to do any voting or take care of any business if they're not there. It's basically just a lost vote. So if 3 of you were to contract COVID-19 and have to self-quarantine, it would be tough for us to make this decision after that fact, I think. I think we could still do it on an emergency base, but to have this direction right now and basically trying to nip this in the bud before it becomes an issue, that's us being proactive and something we can be proactive about, I think. And I think it's a great tool that we need to be concerned about and think about.
Keep them a tool belt.
Pretty much. And for the cost, if you came here saying, well, it's $6,000 to do this, I'd be like,
Yeah,
we'll make do. We'll talk with lawyers.
Just spread out a little further.
We'll figure something out, but with, $10 a month.
Yeah, I mean, I'm concerned, your wife is ill, you don't need to catch anything and bring it to her. My wife just had her last cancer treatment, so she's immunocompromised right now, and she doesn't need me coming home and giving her something, so I'm just thinking about the whole family thing. We're all kind of in the same boat, we don't want to give anything to our families. So, okay, we can have Heidi look into it. I'll send her an email with all the information on the two that I found. There may be more with better deals or whatever. I don't know.
As far as the emergency side of things goes, does somebody maybe want to make a motion to establish that this is okay to do this teleconferencing stuff? Or do we need to?
How about if I make a motion to have Heidi look further into the teleconferencing, get us back the information that we need to proceed with it? That work?
To allow for.
To allow for us to.
Meetings if
Yeah.
the need arises, I think. Just so that it's on the books that, hey, we might be having meetings like this.
And to make sure that James is familiar with it too, just so that in case there's any legal input.
I think that would be smart.
If it came from the League of Minnesota Cities.
Yeah, I would-
That would
it's
already be
already
done.
addressed.
Well, I know, but, just, it'd be nice to make sure that James knows and that he
Oh,
can.
yeah.
I would just get something in the minutes as to get in an official form of a motion saying that we're looking into this and that we may utilize this from this point forward in an emergency basis if we have, not even on an emergency basis, just on a basis that has to be deemed necessary as council and staff.
Did you actually make the motion?
Mhm.
All right, I'll second that motion.
Okay. All in favor?
Aye.
Any opposed? Motion passes 5-0.
I think that's all I have emergency management wise, unless anybody has any questions or thoughts or concerns or brainstorming ideas or things that you would like to be on the forefront of our endeavor here that we're dealing with. But
You could put a big spigot on the outside for hand sanitizer for people to come and fill up their little bottles.
All right, next then is the community health emergency.
So there's a resolution in here, 2020-13. A number of cities are adopting this resolution. It pretty much just states exactly what we did last Monday. But a lot of them are doing it by resolution, that way in case anything goes further, if there's anything that, were to happen, or just so we have it in a formal motion, basically. So that's what the resolution is. If you read through it, everything in here, the resolution, the emergency leave, which is the amendment to the personnel policy, that's everything we discussed last week. And it's mirroring a lot of other cities.
Well, I'll make a motion to approve resolution number 2020-13, which is declaring a community health emergency regarding COVID-19.
Second.
Okay, Lloyd?
Aye.
I'll vote aye, and Tom?
Aye.
Nicole?
Aye.
Kirby?
Yes.
Motion passes 5-0.
And also really what that does is it puts some teeth behind our power as a city to limit things like fee and stuff too. I mean, we can do it, but now that we've declared an emergency, we have a little bit more power at our disposal if we so need to use it. Again, I don't think it's gonna ever come to us having to put the fist and cuffs down, but it's nice to have something on paper saying we declare an emergency, we understand that this is happening. Hopefully everybody else does as well, so.
Number 2, the community health emergency leave is, like I said, pretty much what we talked about last Monday. It's just putting it down in words and having you vote on it, because it does deviate a little bit from our personnel policy, which there again, like I said, it's mirroring all the other cities, so.
Make a motion to approve the community health emergency leave amendment to the city's personnel policy.
I'll second.
All right, Kirby?
Yes.
Nicole?
Aye.
Lloyd?
Aye.
Tom?
Aye.
I'll vote aye, motion passes 5-0.
Okay. The next two resolutions, 2020-14 and 2020-15. Back at the March council meeting, you approved the ordinance amendments for the,
Administrative fines and abatements.
yes, thank you. So in order to make them legal, you have to publish them. But you can do a resolution that you only publish a summary of what changed, so you don't have to publish the entire resolution. That costs a lot of money. So these resolutions are just that, it's just approving us to publish just the summary of the changes.
Make a motion to approve resolution number 2020-14.
I'll second that.
Tom,
Aye.
Lloyd,
Aye.
I'll vote aye. Nicole,
Aye.
Kirby,
Yes.
5-0.
Make a motion to approve resolution number 2020-15.
I'll second that.
All right, and Kirby,
Yes.
I'll vote aye. Lloyd,
Aye.
Tom,
Aye.
Nicole,
Aye.
motion passes 5-0. Next is cancellation of public meetings.
Make a motion to approve the cancellation of the Park and Rec meeting on Thursday, April 2nd.
You can do them both at the same time.
And approve the cancellation of the planning and zoning meeting on April 8th.
I'll second.
All right, Lloyd,
Aye.
I'll vote aye. Tom,
Aye.
Nicole,
Aye.
Kirby,
Yes.
motion passes 5-0. Next is the administrative letter of understanding. That is for Heidi. You are aware that we took Heidi on. This is just added into the contract until we negotiate.
I was gonna ask why she's joining the 49ers.
Because she's not a supervisor. The other union is supervisory union. This is public business.
But then aren't we gonna have this trouble, if you remember that meeting we had with Bill with you and I, between the unions, they can't do this work and they can't do that work. And then is she gonna be under Wayne then? She's in the 49?
No, she's under Deb. Deb is her supervisor.
She's not in the public works. She's an administrative assistant.
But those unions sometimes, I remember when we started with the double union crap.
Well, the bottom line
We've
is,
got to designate what's that work and what's 49.
the bottom line is anytime we make a change that has anything to do with the unions, we have to get out there with the arms and arm wrestle. You know that, right? It's never going to change. It's always going to be the same. So this basically is establishing her work schedule and pay and everything under the 49. Chris Chantry approved this, so I think we just need to go ahead and approve this. And then worry about, when we want to negotiating with the unions, we worry about it at that point in time, in my humble opinion.
Okay, now, when was the 49 contract up? Is that
No, it's at the end of the year, December 31st. So we do have to figure that out.
Well, we have-
a raise now, and then at the end of the year, should we have another raise?
No.
Not till April.
Yeah,
April of next year.
when they have the reviews.
Yeah, that's how, they got a review here in April.
Yeah.
This is, yeah.
Yeah, we put it out to the unions that call us when you're ready to sit down and talk, and, because of all the things going on, I think they
Right.
neglected that a little bit, so. I don't know about you, but I'm not ready to sit down with a bunch of people in the room and talk about it. But we can do a teleconference. No,
When you
It'd be
get
nice
that
if they
place.
could extend that too, just even 6 months.
the contract?
Well, we don't have to have it done until December 31st, so.
Yeah.
And
As long as we
it
have
will only
it done-
take,
as long as we have it done by the end of the year, because that impacts people's pay increases and everything else,
We're public employees, we do not have the right to strike, so even if the contract is not settled, it still
it
goes
goes
on.
under the same one.
So, I don't know, I'll make a motion to go ahead and approve Heidi's letter of understanding for her job as administrative assistant.
Second.
Nicole?
Aye.
I will vote aye. Lloyd?
Aye, I suppose.
Tom?
Aye.
Kirby?
Yes.
Motion passes 5-0. League of Minnesota Cities Insurance Trust liability coverage.
So it's time to renew our municipal insurance, and this is done every year. We do not waive the monetary limits on our municipal tort liability insurance, which means if we don't waive it, it puts limits on what one person can make a claim against the city. So if you say, yes, we want to waive it, then you have to take out additional insurance because someone could sue you for a lot of money. By not waiving it, it puts limits on what they can get out of the city. So, like I said, it's done every year. We do the same thing every year. We do not waive it.
But the limits are pretty high anyway, so
It's,
it's $2 million.
well, no, they could recover no more than 500,000. And that's for one claim, and they could recover no more than 1,500,000 for a number of claims, so.
If you
If
waive
they had 4 claims.
If you waive it, it's 2
Yes.
million.
If you waive it, it's 2 million, but then you have to take out additional insurance.
Yeah, we would.
You hear that in my hearing aids? No.
I'm
My
sure
phone is ringing in
if
my
we
ear.
look for other insurances, it'd be higher than what we did to.
Yeah. So,
I'm not used to doing anything with Roy.
But at least they're not going,
Okay, sorry about that.
I'll make a motion then to accept, does not waive the League of the City insurance.
okay.
I'll second.
Okay. Lloyd?
Aye.
I'll vote aye. Tom?
Aye.
Kirby?
Yes.
Nicole? Motion passes 5-0. Utility bill, discussion on late fees.
So we discussed amongst ourselves that a number of cities, states, and taxes, everybody is waiving late fees, not shutting off water, anything like that. So the city would like to waive the late fees. The bills were due on the 20th. She usually runs the late notices like tomorrow or Wednesday, Thursday, whatever day. We would like to waive the late fees. However, we can still send out a letter to everybody that says, because the program will still generate the letter, like what normally goes out if you're late, we can still generate that letter, and we can put a note on the bottom that says, your account is past due, you have not been charged a late fee, however, please, try to get your, however she's going to word it, try to get your account paid or call to make arrangements if you need to. So she's going to put a note on the bottom of it, but we're going to try to waive the late fees to give everybody a break. And there's a lot of them that need it.
So we're gonna put a time frame on it, or just this is indefinite?
Most cities right now are doing for the month of April.
For the month of April.
And then just
So-
going
That's what we
month by month.
Yep.
Just going monthly?
Yep. And if we need to revisit it, we can revisit it.
Somebody might just way out of hand.
Yep.
Right,
Yep.
yes,
And what
right.
about shutting water off?
We're
We're
not
not
going
None of
to.
it's not.
No.
No,
I don't want that.
Yeah.
and that too for the month of April.
Yep.
Well,
Make a motion to waive utility billing late fees.
I'll second.
That's like it.
all right, Kirby,
Yes.
Lloyd,
Aye.
I'll vote aye. Tom?
Aye.
Nicole?
Aye.
Motion passes 5-0. Next is Wright County Nonprofit Community Dental Clinic. This was brought up by Commissioner Vetch last week at the mayor's meeting. They want to take the current courthouse and take the bottom part of the courthouse and turn it into a dental clinic for those that have a hard time getting insurance or do not have insurance. So currently, there's 15,000 residents in Wright County that receive health insurance through medical assistance, and there's only 36 dentists that are located within Wright County that accept patient insurance. So what they're asking is if the cities will pass a resolution so that they can proceed forward to putting this in place. And it's really going to be needed now, with more people are going
No,
to sadly be on insurance.
Is that just going to be for Wright County residents, or?
No, it's for,
I was gonna say,
it's
you're
for
not
all.
able to keep everybody out.
No, it's for everybody, because there's very minimal places that take insurance now, so, and it's for, seniors. It's,
Well, they, even the ones that do, unless you have an in with them, they put you out so many months.
right.
What, is there, yeah, what's the city, is there a city's cost to this? It just, I know it just says that we're supporting the $2 million.
No,
I
but
suppose
They're trying to get it bonded through the legislature.
Right.
So they're trying to get cities' support to push the legislatures
Yeah.
that, hey, there's big support for this out there.
right, because they're providing the building.
Yep.
So they just now need the support to get everything in place, so. They are asking the cities then to pass the resolution to help them proceed with it.
It'd be nice to see a use for that building.
Yeah. Instead of letting it.
I'll make a motion to approve resolution 2020-16, resolution affirming the city of Montrose support for state capital investments for a nonprofit dental clinic co-located with other government services for low-income people with Medicaid or no dental insurance.
I'll second it.
All right, Lloyd,
Aye.
I'll vote aye, and Kirby,
Yes.
Tom,
Aye.
Nicole,
Aye.
motion passes 5-0. And having then be the letter of support.
Make a motion to approve the letter of support.
I'll second it.
All in favor?
Yes.
Aye.
Any opposed? Motion passes 5-0.
Who seconded that?
Good. Anything else? Motion to
Make
adjourn?
a motion to adjourn.
All in favor?
Aye.
Any opposed? We are adjourned.
Who seconded that one? You? Can't tell some of you guys' voices.
Yeah, sounds the same.
Okay, Sean,
Okay, everybody stay healthy.
sorry. Oh, we need to talk to yours.
I'll get it.
Yeah, I'm gonna go for it.
No.
You did that with the dogs?
On the right.
Yeah. Just have the sun in your
On the right.